you. Next one is Primera Línea, Luis Roberto.
Hello, thank you, Jose, for the opportunity, doctor. Thank you. I've been a part of the program. I have a complaint because now that I know that what I should eat, I worry about what I eat. So, I mean, that's worrisome. One question is, how would you get, I mean, it's difficult, the whole thing, the cultural barrier, because we are what we eat. So it's difficult to change what people are, because we identify with our own culture and what we eat. So it's a process that is really long. And the second one, if I may, how much is this process going to cost the hospital and the whole system?
Who is taking that one?
Yes, so as far as how much it's going to cost, I'm going to leave that to Dr. McMacken. But you know, as we said before, lifestyle is everything. And you know, as a doctor, sometimes, you know, we advise people all the time, oh, you know, lifestyle modification, behavior modification, eat right. But it's easy to say, right, and hard to do. So the real point of this program is to just support patients in their behavior change, which is very difficult. So we're here to just remind people to be in their face, to constantly, you know, every week, hey, eat healthy. These are the type of foods you should eat. You just need those constant reminders and ticklers in your brain to say, okay, instead of the pizza, I'm gonna have, you know, I'm gonna have salad. So I think that's the point here, you know, because as someone else said, we all know the right things to do. It's how do we get to do it and sustain doing the right things all the time.
Yes, and to echo what you're saying, Dr. Harewood, I first of all, I'm sorry that we added some worry to your life. But I want to say that I also feel like one of the strategies that we employ in our program is to focus, you may have seen this, but is to focus on what we're adding to the plate, not so much on what we're taking away, because nobody wants to hear a negative message. Nobody wants to be told, don't do this, don't do that. They want to hear it sounds nice. What am I going to add to my plate? And there is no cultural tradition on earth that doesn't celebrate fruits, vegetables, legumes, and other healthy foods in some regard. So it's just a matter of putting those front and center. It's not about changing someone's culture. It's about making small shifts with the support of a medical team that can advise you. So we have found that to be very effective. And as far as the cost, so first of all, this is a program that for patients that have insurance, it will be like a regular, you know, doctor's visits. The insurance will be billed. For patients that don't have insurance, this is the beauty of us working within the public healthcare system. We have trained financial counselors that can meet with patients, see if they do qualify for insurance, or if they don't, enroll them in one of our fee scaling options. So sometimes the fee is zero, depending on a patient's, you know, family situation and financial status. So this is really accessible to everyone. I will say that the city of New York has made a big investment in us in this service because they recognize the value of reaching all the communities in New York. So they've invested in these programs at health and hospitals.